goes. Should they be coming in, say, getting a yearly exam done and having thermography, looked at thermography, you know, have that testing
yearly
done?
testing? Yes, I'd say, you know, if they have family history in their 30s up to 40s, they can. But after 40, yeah, once a year is good as long as they're getting good readings. If we start seeing something abnormal, we want to keep an eye on it. We may have them come in a little bit more often if there's something, you know, that looks a little hot that we want to make sure it's going to respond in the right direction.
Okay, yes,
so we'll put them on a
exactly.
protocol and keep an eye on them a little closer than that. So yeah, but yearly and annual screening, and that's an interesting thing too, because now for insurance billing, which is a big thing with most people,
sure.
Blue Cross and Blue Shield have been great about reimbursement, and they need a doctor's prescription, and if the doctor writes up for an annual breast screening, and there's a special code for that, they seem to be just fine with it.
Perfect.
So, and the doctor doesn't put themselves at risk because they're just telling the client what they need to know, and that is they need to get an annual screening. So, yes,
Good.
it's been really great.
Now, as far as referring out, say a woman comes in and she has the testing done in your particular clinic, and you find some abnormalities. Are you, say, have them go for a mammogram at that time, maybe, or use some other procedure, or how would you work something like that?
It depends on it depends on if they just came to me cold and didn't have a doctor who had done something before and then was using this as a second detection. I always send them back to the doctor who referred them.
Okay,
and then I call that doctor. I give them a copy of the results. I give the doctor a copy. I go over those results with everybody. So we're all on the same page working together as a team.
Excellent.
And if the doctor feels he needs somebody else to or she want to refer to somebody else, a lot of naturopaths refer to me. So if we're getting something that needs an oncologist, I have quite a large selection of the leading people in the Bay Area who I trust. If a woman's got implants that need to be removed and concerned about her breasts looking nice after, we know ones that are more like plastic surgeons who can take care of that. So I'm very interested in helping them get the best service they can. So yeah, so cross-referring is important.
Good. Now we're talking tonight about thermography as far as breast cancers, and what else can thermography be used for? How about cardiovascular? How about heart diseases? Can we detect anything there, or is it just really, okay?
So basically what you're looking at is the surface of the body. We can't look behind the abdominal wall, behind the lung cavity, but through looking at the ophthalmic artery, we can see the amount of heat, and if the body has one side that's depleted, it creates its natural bypass, and over the veins and the arteries flush the other side, and so we can look at the comparison of the two sides and tell the level of stenosis and the narrowing of the vascular system, and how clogged up the vascular system is, and so we can tell them, we can keep an eye on them with that and talk to them. We do also natural protocols to help clean that out, and then can look again after 6 months to a year and make sure that they're headed in the right direction.
Excellent.
So we can look at that. That is a reflection of the carotid artery. We can look at their hands and feet for the heart. And we can also look at the thyroid gland and a complete lymph study. I've had clients with lymphoma that we wanted to do a complete lymph study on, and you know, numerous other things.
Excellent.
Yeah.
So now, if we find something, we have a patient come in to your office, as an example, and you see something there that looks like, well, there might be a problem here. Is there a protocol that you would have to say take these herbs or take something to go ahead and stop this pathology that might start? So in other words, they don't have to go ahead and maybe get a mammogram or what have you? Right.
Well, for almost all the different things that I can detect, a thyroid, all the different, first of all, I'm certified nationally and internationally as a thermological technician, so I've been trained as certified, board certified.
Good.
But I'm also a clinical nutritionist. My MA is in clinical nutrition.
Good.
So I understand what it takes to build health. And so we're just using this detection device not only to tell us where the person's at, but to monitor them as we see them change. So yeah, we can put them on all kinds of protocols addressing their health concerns. And there's a naturopath on staff and an acupuncturist on staff at my clinic. So
and I think that's important because see here, you know, when a person goes and say has a mammogram or whatever kind of pathology that they find, whatever procedure they're doing in the Western medicine, they say we just need to take this pathology and cut it out, or do this or do that. It's very non-invasive. It's so traumatic for the body.
Yeah.
And what I like about what you're doing, you can, if you detect something, you have a protocol where you can go ahead and prevent it. Or
Right.
you can put them in
Right.
put them in a direction, put them on a path where they can start following.
Well, and if we find it early enough.
If you find-
if
right,
we're
that's what
not
I'm saying.
finding it early, we're finding an advanced stage of breast cancer, my advice to them would be probably pretty close to what their oncologist, their doctor would be too, and that is, I think removing it, getting a clean margin
Yeah.
is the best for the body.
Yes, yes.
Now, whether or not they radiate it and do chemotherapy and all these other things, I like to let them know all their choices, but I
Sure.
would never tell them not to do what their doctor says.
Absolutely,
You know,
of
because
course
it's
not.
always their choice. But
Right.
I think the key there is to empowering them to make the decision.
Right.
And not feeling a victim to being forced to do things they don't want to.
Well, don't you think when a patient comes in, like you just said, they have choices?
Yes.
And you should give them different, 3, 4, 5 different options and say, this is, you can do this, you can do this, you can do that. At least they can make a decision and feel good about making a decision
Right.
for their health.
Right.
Because, see, otherwise, if say they go in and say the doctor makes a decision for them, then they don't feel empowered, they don't feel good about it.
Right. And a lot of times the doctors are kind of forcing them to make their decision out of fear.
Exactly.
And you know, like if you don't take it off, you're going to die. So
And I think that's tough.
that's unkind.
That's
It's just,
really unkind,
It
right.
is, because they're kind of using that to overpower them, and no one makes a good decision when they're fearful. So
Absolutely, I agree with that. Well, I always tell people, I says, listen, if you're an oncologist, if you do have, say, they detect cancer, and your oncologist says only do one thing only in chemotherapy or whatever, I say go for another opinion, or maybe another opinion. And look at all these options that you have. Because I think sometimes when people hear the word, say, cancer as an example, they think it's almost like, wow, I got cancer, and there's no way out of this. But there is a way out of it.
Well, there's lots of things you can do to build your immune system up.
Sure.
And what I find with the women who are using thermography to monitor their breast cancer is they need to keep their stress factors down. Because when you're under stress, you're not producing your T cells and fighting infection and keeping your body healthy. So I do a lot of counseling, you know, what are you
Good.
doing to get away from the kids and play and have fun, you know. So it's all part of the whole picture. It's not just taking pills or
That's right.
exercising. Yeah.
Well, we're running out of time here. We can go on and on and on for hours here, but we're about out of time. One question before we leave the show tonight. What age should a woman start coming in, say, to your clinic for thermography? What would you suggest?
I would suggest if they don't have any abnormal symptoms such as lumps in their breast and stuff, 35 or 40.
Okay.
I wouldn't, if they were 35 and they came in and got a healthy reading, they wouldn't really have to come back every year until they hit 40. But I have taken images of my 17-year-old daughter because she had an abnormality I wanted to check. It's totally harmless, and it was a nice way for us to check and not worry about something that was concerning us. So, you
Great.
know, it's a very safe technique.
Well, I like that it's totally harmless.
Yes.
Getting no radiation, getting nothing that's harmful to the body, and still being able to go ahead and look at the body as a whole and finding out
Where you stand.
where you stand. That's important.
It is.
Because I think people can make a really good decision off of that then. Well, Nancy, it's a pleasure having you on the show today.
And thank